We're following up on the biggest stories. Leaders of the People's Democratic Party, the PDP, have called for the intervention of the United States, the United Kingdom and the European Union. In the judgment of the Supreme Court, the party leaders made the call on Friday as they continue their protest against the judgment of the Apex Court, which sacked the PDP candidate Emeka Ihedioha as the governor of Imo State. In their numbers, led by the party's national chairman, Uche Secondos, the PDP chieftains stormed the US and UK embassies in renewed protest in Abuja. What does this mean to the party? Will they get support from the international community, though? What if the UK, the US and the EU say nothing to the PDP? What then? Data feeds are coming through in one place simultaneously on all our social media platforms, on channelstv.com and on youtube.com/channels, where you can follow us right now on m.channelstv.com and on Facebook as well. We've got all our conversations covered. Be part of the show. Tweet at Gimba Umar CTV. Use the hashtag State of the Nation. And let's get your thoughts in. Governors of the Southeast states have concluded plans to establish a security outfit similar to Operation Amotekun, recently launched by their counterparts in the Southwest. The chairman of the Southeast Governors Forum and Ebonyi State Governor Dave Umahi announced this when he hosted a general officer commanding 82 Division of the Nigerian Army, Lasisi Adeboye, in Abakaliki, the state capital. Although the name of the security outfit is yet to be made public, Channels Television, we're bringing this to you live. The governors have written to the federal government and also met with military authorities on their plans. Now, where will this take us next? The governments have already pledged it will fund community policing. We had that about 3 weeks ago. Now, what will a regional security outfit be to the states and the regions? Will the North and the Northeast and the Northwest, for that matter, follow the same way? The novel coronavirus is now declared a world status concern by the World Health Organization, the WHO. It's alerting governments and every human being as Nigeria sets up a committee to prevent an outbreak in the country. Already, the United Kingdom has confirmed its first 2 cases of the new coronavirus a day after the WHO declared the outbreak a global emergency. In China, at least 213 persons have died as more countries are announcing plans to evacuate their citizens from Wuhan. That's in China, the city where all this is breaking out from. What are health authorities doing in the face of this challenge and the Lassa fever challenge as well in Nigeria? We'll analyze the issue starting now. It's prime time here in Lagos, and this is State of the Nation. Welcome, everyone. We're starting up with the biggest stories yet. The coronavirus has been given a world emergency status by the World Health Organization, the WHO. The world body declared it's a global health emergency on Thursday. This much we know about the novel virus. Coronavirus highlights. Let's bring it to you now. Now, the death toll we know has risen to 213 in China. 9,809 people are confirmed to have been infected in China, which now faces the disease in all provinces of the country. The Nigerian government has warned that persons coming in from China to Nigeria should isolate themselves for at least 2 weeks as a precautionary measure. The 102,000 persons are under medical observation with possible symptoms of respiratory ailments in China, which has Nigerians living in the Guangzhou province in that country. Over 16 countries have reported cases of the coronavirus to this moment. The UK has confirmed its first 2 cases of the coronavirus. Nations are evacuating citizens and are also issuing travel advisory. At this point, the Chinese president, also Xi Jinping, has said that his country is facing a grave situation. The federal government of Nigeria has issued a travel advisory asking citizens not to travel to China for now, and those returning from China should isolate themselves for about 2 weeks. That's, of course, is to prevent any form of spread. That much we can bring you as an update on the coronavirus. But back home in Nigeria, a committee has been set up by the government on the coronavirus. 5 international airports are already penciled down in this exercise. They are the Enugu, Lagos, Rivers, Kano and the FCT airports. The Minister of Health, Dr. Osage Ohanire, said this at a news conference on Tuesday in Abuja. He also said that government will set up multi-sectoral committees to scale up the surveillance and vigilance over the case of the coronavirus. According to the minister, the committee will help to scale up surveillance to detect suspicious cases and ensure containment. That's not all. We're also dealing with one very important issue, which is the Lassa fever we're facing today. This is the highlight from the Ncdc. The Ncdc Lassa fever highlights in week 4. Remember, we've been trailing this from week 3 when we brought you information from this agency just last week. But in week 4, the number of new confirmed cases has increased from 81 to 95 from week 3 to week 4. This is the slide that you're watching for week 4 now. These were reported from 19 states. A pregnant woman has died in Enugu, one of the states affected. We're just getting that information. Ondo, Edo, Ebonyi, Kano, Borno, Nasarawa, Kogi, Rivers, Abia, Adamawa, Benue, Kaduna, Delta, Taraba, Plateau, Bauchi, Osun, and Ogun states are the states that are affected. The 19 states effectively being affected by the Lassa virus in Nigeria. The number of deaths has increased. The overall case fatality rate, that's the CFR, if we could get that slide back, for 2020 is 15.9%. That's it, 15.9%. You can see just at the right corner of your screen, just to the extreme right of it. 15.9%, which is lower. That's what the agency is telling us. Lower than the CFR for the same period in 2019, which is 19.7%, which is, in a whole, an improvement from what we recorded last year. We don't know, we've not gotten any confirmation from the Ncdc on whether or not there will be a prolonged period of a dry spell, which is the Hamilton season, where those rodents are able to get to the houses where those foods are being stored in barns and in our homes, in the kitchens, and then bringing about that epidemic. The predominant age group affected is 11 to 40 years, 5 healthcare workers, 3 in Kano, we understand, 1 in Taraba, and also 1 in Borno State were affected in the reporting week 04 of the epidemic that has broken out in the country. That much the Ncdc is telling us. That latest on the Lassa fever, an outbreak that has happened every dry season, where experts say that harvest from the farms ends up in barns and in homes, leaving the rodents with no choice than to seek food by all means necessary in our homes. And that's where the story gets worse. Our correspondent Ibrahim, that would be Idris Jibrin in Kano, tells us about the situation in Kano and the news of the deaths of 3 persons.
You may call it occupational hazard, but for Safia and Murja, the death of their husband is much more than that for obvious reasons. He left his mother behind and over 10 children.
His death is a great loss to immediate family, extended family, community, and the society in general. Is a great loss to us.
Health workers at the Aminu Kano Teaching Hospital suspect that Dr. Habib and his colleagues got the Lassa fever virus from a patient that was rushed to this antenatal unit, presumed to be suffering from prolonged labor. She was rushed to surgery and later to ICU, where she eventually died. This ICU is a highly restricted area, but after a thorough process of disinfection, we were given access to the place where the first Lassa victim was temporarily isolated.
But isolation is basically 2 types. If you want to exercise negatively, you can exercise it negatively. If you want to exercise positively, that is when you are trying to protect the patient, because the patient's immunity is low and your own is okay. There is possibility for you as a healthcare personnel to even infect the patient. So that is when we are calling it positive isolation. But in negative isolation, the patient is likely to infect other people.
In quick succession, 2 other doctors also died.
What we are doing is to ensure all the persons that were in close contact with one index case, that is the woman that died, and the health care workers, all their contacts are traced and then followed up.
Their deaths were eventually confirmed to be from the Lassa virus, but it took 48 hours to find out as their blood samples were sent to Irua in Edo State for testing.
The classical presentations were not there. But then if they could test the blood and confirm it positive for Lassa, then I will surrender. And that was what happened later, 48 hours later.
Hospital staff say the lack of facility for isolation could have contributed to death of the doctors.
We should have a reference lab where we can test. We have RT-PCR, we can do ELISA. We should have these equipment in all our hospitals.
Although the Kano state government says precautionary measures have been put in place, however, doctors believe that prevention is better than cure.
Very well, indeed, that much we know. Of course, our correspondent in Kano State giving us that update. We will do ourselves well when we cover up on foodstuffs in our homes. Don't take that for granted, just to prevent the further spread of Lassa fever. We understand it has gone to 19 states at the moment. Let's shift gears now. Governors of the Southeast states have concluded plans to establish a security outfit similar to Operation Amotekun, recently launched by their counterparts in the southwestern part of the country. The chairman of the Southeast Governors Forum and Ebonyi State Governor Dave Umahi announced this when he hosted the General Officer Commanding 82 Division of the Nigerian Army, Lasisi Adeboye, in Abakaliki, the state capital. Bishop Johnson is a security expert, retired from the United States Army. He joins us from our Abuja studios. He's also there with Professor Ibrahim Ado Abubakar, a systems security engineer. I want to thank you both for joining us from our Abuja studios. And joining us via Skype is Mr. Leonard Anyogos, a member of Chatham House in London. He joins us via Skype. Many thanks indeed for joining us as well. Let me get your views, Mr. Leonard. First of all, let me get your views just before we flip the coins. Because Nigeria is faced with this very perennial, disturbing issue of the Lassa fever, and then we're trying to protect ourselves from the coronavirus getting into the country. Is this much of a big challenge, do you think, considering the several security situations we face in the country today? Kidnapping for one, banditry for two, Boko Haram unleashing mayhem in the northeast part of the country for third place?
Nigeria presently is facing a lot of challenges. Security-wise, we are in a state of dilemma. And when you find yourself in a very helpless situation, you need a situation where you have to rise up to the challenges. And that is why we are having this regional outfit. To me, I think it's a welcome development, but we have to do it with some form of regulations, because the Southwest has come up with their own regional outfit. The Southeast is about to do the same. I know that South will follow suit. So, but we need some kind of regulation so that we can have a tidy framework. Otherwise, it's a very perfect reaction to the challenges. We must face the reality that we are in a dire situation, and dire situation recognizes the fact that we have to face those challenges squarely. Okay,
we're going to go on a short break now, and when we come back, I'll face very squarely our guests in my discussants in Abuja, Bishop Johnson, as well as Alhaji Abubakar Ado as well. Join us in just a moment.